So many of you have written to me to talk about hydrochlorothiazide. Hydrochlorothiazide belong to a family called the thiazide family, which is under a larger umbrella name we call the diuretics. Hydrochlorothiazide is one of the common medications that are given to patients with high blood pressure. So in many cases, they are given to patients with other antihypertensive medications as part of it. So, apart from helping with high blood pressure, hydrochlorothiazide also play a role in patients with heart failure. Now, how does it work? What is the mechanism of action? In the kidneys, there's a unit of the kidney we call the nephron, okay? And that nephron has some tubes. So what hydrochlorothiazide does basically is that in that tubules, which we call the convoluted tubules, it prevents the reabsorption of sodium. Now, because sodium is osmotic, it draws water with itself. So as the kidney is losing sodium, water goes with it. That is how it helps in the treatment of heart failure, and that's how it also helps to reduce blood pressure. So it works very well in combination with other medications. However, despite the good function that it plays, it has side effects as many other medications. So what are the side effects? Just before I talk about the side effects, I need to say this clearly, that side effect is not a reason to stop taking a medication. Side effect only becomes a reason when it is causing you problems. Okay, for example, if you are having slight headache from any medication, it is not a reason to stop the medication. But if the headaches are now becoming very severe, you need to see your doctor so that the medication can be changed. One of the common side effects associated with hydrochlorothiazide is dehydration. Now, because you are losing so much water, the patient can be dehydrated, especially for elderly patients. So, one of the things that you should watch out for is that, are you having dry mouth? Are you becoming extremely weak and all of that? If you are having such, most times the treatment for that is just rehydration. The second side effect is frequent urination. So because you are losing so much water, you have to keep urinating. So this is a side effect of the medication. But in most cases, doctors will not bother about this because it is expected. The third side effect is dizziness or lightheadedness. I've talked about this in my previous video because this is common with patients taking antihypertensive medication. So I won't talk so much about it. Now, let me start talking about the common side effect that is of concern to most doctors. One is hypokalemia. So because potassium is lost during this process, your potassium level can be low, which is very dangerous. So once you start taking this hydrochlorothiazide, like other diuretics, you should monitor your potassium level. This is another reason why some doctors will prescribe hydrochlorothiazide with other antihypertensive medications like lisinopril or losartan, because lisinopril and losartan cause potassium to be raised. Now, when you are not taking hydrochlorothiazide with all those medications, as lisinopril is trying to raise potassium up, hydrochlorothiazide is trying to bring down the potassium down. So the potassium level will largely fall within the normal limit. This is not to say you should not check your potassium level. So the other side effect that is of concern to many doctors is hyponatremia. Remember, I said the mechanism of action of this medication is that it inhibits the reabsorption of sodium. So sodium is lost in urine. Extremely low sodium is also dangerous. I've seen patients that came in with seizures because of their low sodium level. That is what you also need to look at for. The other side effect that is of concern to most doctors is hyperuricemia and hyperglycemia. That simply means increased uric acid level and increased blood sugar level. So hydrochlorothiazide has been shown to cause this increment in sugar and uric acid. So that is why most times for patients who have gout or those who are diabetic, most doctors will want to prescribe alternate medications. But if they choose to go ahead, you should routinely check your blood sugar level and your uric acid level. So for males who have started taking this medication, watch out for erectile dysfunction. That is to say, you are not having a good erection. If after starting this medication, you notice that you are not having good erection, you should discuss with your doctor. Now, having said all of this, it is not a must that if you are taking hydrochlorothiazide, you must have these side effects. So I'm just saying this so that you be aware. In case you start having any of these side effects, you should know the appropriate thing to do. If you want me to talk about other antihypertensive medications that you are taking, put in the comment section and I will do a video to explain it. I know you've learned something today. Please like, share, and comment, and I'll see you in the next video.